Thank you very much. Now, today is World AIDS Day, and the theme this year is Know Your Status. And joining me now with more on this is Khanyisile Mavimbela, who is HIV positive and works for an incredible organisation called Mothers to Mothers in Africa. Great to see you. Thank you very much for coming in. Tell me about your story, because you were pregnant, weren't you? And you suddenly had some devastating news. Talk me through what happened.
Okay. I first met Mothers to Mothers 12 years ago when I was 4 months pregnant during a routine antenatal checkup, and I was asked to have an HIV test at the local facility, as it was a protocol for every pregnant woman to know her status. So I agreed. Then the nurse explained the procedure and she shared how she's going to do the results. So my results were positive. Luckily, she told me that she could refer me to other women who are in the same position as I am, and I was referred to Mentor Mothers employed by Mothers to Mothers, who took me through my journey. Although it wasn't an easy journey, but they helped me understand, they helped me cope, they helped me adhere well to my antiretrovirals, and today I'm what I am because of what they did to me.
And what about your daughter? You must have been very worried that she would be HIV positive.
Yes, that's very true. At first, when I discovered that I was HIV positive, I was so scared. And honestly, I thought death was just a few months away. I was very worried I would infect her with the virus. But luckily, I got this education, I got this support, which the nurses and doctors at that clinic could not offer just because they have a lot of work to do, the clinical services. So they referred me to these Mentor Mothers who had all the time, and they were like sisters to me. They gave me the support. They shared their own experiences, and from their experiences, I wanted to do exactly what they told me. And that yielded the good results, as today I have 2 daughters who are HIV negative.
Great. That's great to hear. And Mothers to Mothers is working in lots of parts of Africa, but in one area that you're involved in, 1 in 4 adults are reported to be HIV positive, which is an incredible statistic. So what does Mothers to Mothers do to try and educate women, young women, teenagers about HIV?
What Mothers to Mothers is doing in Africa is to employ mothers living with HIV who has been former clients of Mothers to Mothers to work as peer educators, support, educate, and share their own experiences on living with HIV. We work with both the HIV positive mothers and HIV negative, the adolescents, and ensure that their younger children are taken good care of, they reach their key developmental milestones, and they are well nurtured in life.
And the message today on World AIDS Day is know your status, and that's very important, isn't it?
Yes, it's very important. To me, knowing your status will mean being responsible of your own health and ensuring that you do what is necessary for you to stay healthy. If you're HIV negative, stay negative. And if you're HIV positive, you need to start and remain on treatment so that you lessen the chances of infecting either your unborn baby, the baby that you're breastfeeding, or your partner if he's also HIV positive or negative, because you could be HIV positive, but if you are not taking your treatment, there are chances that you could reinfect your partner. So one has to be mindful of that all the time.
And we've come a long way, but there's still a huge amount of stigma around HIV, isn't there?
Yes, there is. But in the past years, I've been with Mothers to Mothers for like 10 years now. So I have seen a drastic change, because previously it was very difficult. People were not living openly with their status. And like I said, I'm an employee of Mothers to Mothers, a mentor mother in Eswatini. So we also run support groups. In these support groups, previously we were having like the adults coming for the support group, but now we've seen a change as we have young mothers between 16 and 19, 20 ages coming to the support group, which means that the stigma has lessened, although we're not where we would like to be, because we're still worried about our adolescent girls, and myself included. My eldest daughter is 12, she's almost there. So we are still having this huge job to do, to educate our adolescents, to understand that as mothers we've done our part. We have ensured that we prevent them from contracting HIV, and they should understand that if they are infected with HIV now, that could mean another story. So as an organization, we are trying our level best to bring them on board, educate them, and make sure they understand why it is so important to avoid safe sex without protection and how to prevent themselves at all times.
Yeah, it's such an important message. Khanyisile, thank you so much for coming in, and it's great work you're doing. I know you're going back home in a few days' time to carry on that important work, but thanks for seeing us.
You're welcome.